Hello, everyone, and thank you for joining today's webinar on opportunities to improve menstrual health and hygiene. As Cameron mentioned, you may use the chat box to let us know if you have any technical difficulties. We can address those as we go. We also encourage you to leave questions along the way. One other thing is that this webinar will be recorded so that we can post it on the STEP website and share it with you after the presentation. My name is Andrea Stoll, and I'm joined today by Laura Amaya from FSG and my colleague Tyler Ovington. Our guests today are going to present on two recent reports related to menstrual health and hygiene. I'll let them explain both of those soon. The webinar today is funded by the Bill and Melinda Gates Foundation and is being brought to you by the Sanitation Technology Platform, also known as STEP. RTI International is the implementing partner of the STEP program, which helps transformative technologies reach the people worldwide who need them most. We've got a fair bit to cover today. Tyler, I'll have you forward to the agenda. The first thing that we're going to cover is key changes in the global menstrual health and hygiene space since 2016, along with remaining gaps and opportunities for further action and investment. Then we're going to take a deep dive into the market opportunity for one particular product category, the decentralized menstrual hygiene incinerator, and we're going to be focusing on two target countries, both India and South Africa. We will also take a bit of a dive into key market segments and procurement drivers for these MHP incinerator products. So with that, I'm going to hand over to Laura.
Thank you, Andrea, and thank you everyone who is joining us today. I am very excited to see the different places where people are joining us from. I see people all over the world and across different time zones, so thanks again for making the time. I'm really excited for today's webinar. I'm thrilled to learn more about RTI's work, and I'm delighted to share some of the insights from FSG's recent report, as you can see on the screen, titled Advancing Gender Equity by Improving Menstrual Health. The report was published in April this year, and it was also supported by the Bill and Melinda Gates Foundation. Over the next few minutes, I'll walk you through some of the core challenges still present in the menstrual health and hygiene landscape, as Andrea mentioned, and then I'll outline some of the key opportunities for action that actors in the field can take to improve menstrual health and hygiene for millions of women and girls around the world. If we go to the next slide, I'd like to just take a step back and start with the scale of the challenge. Today, over 500 million women and girls around the world do not have, quote unquote, what they need to manage their menstruation. And this was a survey done of women where they were asked, do you have everything you need to manage their menstruation? And 500 million women and girls we've extrapolated from survey results do not have what they need. And not having what they need includes, of course, a lack of adequate menstrual products and materials. And you can see some insights from 2016 on the screen. But it also speaks to things like poor access to the appropriate wash infrastructure. It also speaks to a lack of knowledge and awareness about menstruation. And what's really interesting is that the challenge is present across different geographies and also within individual countries. It manifests in different ways, both developing countries and developed countries. So if we move on to the next slide, we see that there is a correlation between increased economic standing and improved menstrual health and hygiene, MHH, at a population level. So in countries like Uganda or Ethiopia, on the left-hand side, that have lower per capita GDPs, less than 40% of women report having everything they need to manage their menstruation. And by contrast, a country like Indonesia on the right-hand side where the per capita GDP is nearly 4 times as high as countries like Uganda or Ethiopia. Close to 80% of women report having everything they need. So that's an interesting finding. I think what's even more interesting is that within individual countries, it is actually stigma and cultural norms that affect MHH. And these aren't necessarily correlated to wealth and don't necessarily coincide to the same wealth quintiles across countries. So in some countries, it was women in the richest quintile that did not participate in their daily activities during menstruation, be that work, be that family activities. And then in other countries, we saw that it was actually women in the poorest wealth quintiles that were excluded from daily activities. And this accounts for both self-exclusion and sort of enforced inclusion or exclusion encouraged by others. And so what we really see on the next slide is that improving MHH, menstrual health and hygiene, requires an interdisciplinary approach that is also cross-sectoral. You'll notice a slight change in the terminology. Some of you will notice. Historically, menstruation has been referred to as menstrual hygiene, with a heavy focus on the hygiene component. And the last few years have seen a change in the field to really focus on both the component of hygiene and the component of menstrual health, which really speaks to the interdisciplinary nature of the challenge. We continue to see that there's a need to bridge across sector silos to consider really the full experience of a woman. And not just the full experience of a woman, but the full experience across her entire life. How does knowledge and awareness of menstruation, for example, affect her and her partner's reproductive health choices? And how does that change at different stages in life? And you can see that in the green circle on the left. How does access to menstrual products of a woman's choice shape her experience with menstruation? And again, you can see this in the orange bubble at the bottom. Really important, how does the type of wash infrastructure she has access to have an impact in her well-being? How do social and gender norms influence how she and other actors perceive her menstruation and react to her menstruation? And then what we see in the broader box in gray at the back, how do broader policies and broader systems play a role in perpetuating or dismantling some of the inequities that are related to menstrual health and hygiene? So what I'll do over the next few minutes is to summarize some of the findings from our report along these dimensions. But I really do encourage all of you to have a look at the report, and you can see the link on the screen and find it on our website, fsg.org. Starting with limited knowledge of menstruation, we see that there is a greater awareness of the importance of puberty as a pivotal moment in a girl's life. And there's a recognition that menstruation must be considered throughout a woman's life. And this wasn't the case in 2016, and so we've come a long way in the last 4 years. There's a significant gap that is present for women across different stages of their life. So we see at early stages, a significant proportion of girls do not actually know what their menstruation is before their first period. And I see that some of you are joining us from India. Actually, over 70% of girls in India don't know what menstruation is the first time they have their period. And that's pretty shocking. And it's not only in India. We see this across different geographies, including in some developing countries. Now, this impacts the way that women perceive menstruation later in life. And in fact, 80% of teens who are out of school, and therefore less likely to have an adequate knowledge of menstruation through their school education, report feeling shame when menstruating. This can lead to some of the self-exclusion. And then as a woman moves further into her reproductive years, we see that this lack of knowledge also translates into barriers to accessing contraceptive health and family planning for women who do not have a clear understanding about the link between MHH and sexual and reproductive health. And this is actually not just for women, but it's also impacted by the way that men in these women's families understand MHH. In the next slide, we see, I'm going to talk a little bit about menstrual product access. And we see that there are disparities that reflect market failures for commercial products. We see that products are, on the good side, increasingly viewed as a component within a broader set of solutions rather than a sort of standalone fix. And what is more encouraging is that actually a range of actors are beginning to recognize the importance of going beyond just access to a single product to recognize the relevance of informed product choice. What is the product that a woman wants, and how is she able to make that choice in the right way, or in the way that is most appropriate for her, rather. However, we do see that there is a trade-off between cost and quality. And this is particularly acute for rural populations, and we'll see that in a minute. So menstruators, women and girls largely, but also people who menstruate who do not identify as women and girls, can find either high quality products that are expensive or more affordable products that don't actually meet their desired standards in terms of quality, in terms of privacy, in terms of disposal. And so at the same time, we see that there are growing environmental concerns, and there's a significant need for markets that are more sustainable. So these environmental concerns influence the conversation about menstrual products more and more in terms of the composition of the products, the way in which these products are used, and the way in which these products are disposed of. And so, this is undeniably encouraging from an environmental perspective, but at the same time, it can also exacerbate the sort of cost-quality dilemma if organizations begin to see this as a barrier instead of an opportunity to innovate. So I said we'd talk about the disparities between urban and rural, and we see on this slide that the biggest gap in access to menstrual hygiene products is really in rural areas, where most women and girls, you can see in the orange bars, use cloths to manage their menstruation. However, in urban areas, we see that there are also significant gaps. So there are still a number of women that use cloths and cotton wool. And then we also see that particularly in urban areas where access to certain products is greater, women use pads as their product of choice, or certainly as the most commonly used product. And it's good in terms of, if we see Indonesia at the bottom, there's near 100% use of pads among women. It's slightly lower in countries like Niger. But this again brings us back to some of the challenges related to the environmental concerns that have been expressed by different players in the field. And I suspect this is something we'll continue to discuss throughout the webinar. On the next slide, we see that there's a real interplay between knowledge and awareness of menstrual health and hygiene, access to the products of women's choice, and then the access to the right kinds of sanitation and wash facilities to meet the menstruation needs for women and girls. So as we know, sanitation has been the entry point to MHH for many organizations, and hence the historical focus on menstrual hygiene. I guess the good news is that there are more efforts than there were in 2016 to integrate menstruation into the design of sanitation systems, including in terms of disposal and waste management. And this links back to the environmental concern that I highlighted a few moments ago. In addition, we also see that the wash sector is moving towards a more holistic approach to wash that also addresses social norms and education in terms of how women and some of the influencers, be them men, be them older women, experience menstruation instead of just focusing on sanitation and product access. Now that said, there are still key challenges in terms of accessing the right kinds of sanitation facilities. And these include, as you can see on the chart on the screen, privacy is a big one, and that speaks to really the superstructures of sanitation facilities. Things like the availability of clean water and soap, which is not readily available in many geographies. And then one of the things that wasn't included in the survey, but we have strong qualitative evidence for is that there is a lack of appropriate disposal systems, both for menstrual products as well as for sort of blood itself. And so we see that this exacerbates the challenge to access to the right kinds of products that women want and need, not least because multinational companies are increasingly hesitant to enter markets that don't have the appropriate sanitation and waste management infrastructure to handle the disposed of menstrual products. So I think that brings us back to some of the challenges and the intersections across the different historical silos in the fields. Now, as I mentioned earlier, stigma norms play a critical role in shaping a woman's experience with menstruation across her entire life. So we see, of course, that there's stigma around menstruation present at the individual and at the community levels. And these shape harmful social norms that impact women negatively during their menstruation, but also around their menstruation, not necessarily just while they're menstruating. So there are, for example, external narratives that cause shame and self-stigma and lead to self-exclusion from women's daily activities. The community level, there are cultural and religious and social norms that reinforce both the invisibility of menstruation and some of the aspects linked to the exclusion of women from broader societal structures. But then we also see that stigma is pervasive across other levels, and we see this in the sort of outer part of the graphic. At the institutional level, we see that MHH is overlooked in leadership and in decision-making. And this isn't necessarily intentional, right? This may be due to taboos or due to the lack of female representation. And then we see stigma and social norms playing out at the broader systems level. So menstruation is largely absent from media, largely absent from public discourse, largely absent from policy. And so here we see a need to address stigmas and taboos, not only in communities, but I think within our own network of organizations. And this is particularly relevant seeing the mix of people joining the webinar today. I'd like to end this brief presentation with 6 opportunities for action that we identified to improve menstrual health and hygiene for the 500 million plus women and girls that do not have access to everything they need. So the first one is an opportunity to build the data and the evidence base that helps improve coordination and increased resources for MHH. And I suspect a lot of us joining the webinar today will play an important role in shaping this opportunity. There's also an opportunity to increase and improve knowledge and awareness of menstruation for women, and really important to focus on men as well, not just a women's issue. There's an opportunity to create menstrual products, new menstrual products that meet the unique needs of women and girls in different contexts, and these may include, for example, disposal. There's another opportunity related to products, which really hinges on breaking the cost-quality trade-off of the existing menstrual product portfolio by engaging both corporate multinational actors and social, more local social entrepreneurs. There's, of course, an opportunity to address stigmas and taboos related to menstruation from, individuals all the way to institutions and broader systems. And I invite all of us on the call today to reflect on the role that we play in breaking down or inadvertently perpetuating some of those stigmas and taboos. And then a really big one, which I think is a good segue to the RTI team, around designing wash solutions that address some of the critical issues in disposals, such as the management of menstrual blood, and then the disposal and the management of actual menstrual products. So I'll pause there. I'll hand it back to the RTI team, and I look forward to Tyler's presentation.
Great. Thank you so much, Laura. And I will reinforce your recommendation to the audience to go find that full report that Laura just summarized. It has a lot of great additional detail about these historical challenges, about recent progress, barriers that need to be overcome, and some more on these discrete opportunities for further action. I'm going to expand to that end on one of the opportunities mentioned the opportunity to design wash solutions that enable privacy, hygiene, and waste management. Our STEP team published this report late last year looking at the market for decentralized incinerators for menstrual hygiene products. These incinerators are an emerging product class that can be used in a women's bathroom facility to enable safe disposal of sanitary pads. And our report was primarily developed to help innovators designing new wash solutions to consider that market opportunity. So I want to stress, as I transition into our material here, that our report relative to Laura's is very narrow. So we focus specifically on wash infrastructure, specifically on disposal, and we look at one disposal option, which is the decentralized incineration. So we're not going to get into on this report the pros and cons of disposal versus incinerators versus other options for disposal. But I do want to point out at the beginning here, like Laura said, that there are significant risks associated with a poorly managed disposal process, no matter the route taken. And those risks are posed to both sanitation workers and the environment at large. So we do feel that no matter the disposal option, that it's really important, like Laura said, to have this user-centered design kind of at the beginning of the design process for the solution, whether it's for a product or for a system. So we want to stress that's kept front of mind, and just caveat today's presentation by saying that while incineration, I think, is a promising option in many scenarios, that it might not be the best option for all scenarios, but we're not going to cover that really today. So I wanted to share at the beginning an example of what I mean when I say a decentralized incinerator for menstrual hygiene products. So to make sure we're all thinking of the same kind of product, I have here an example of the Safe Hygiene for Everyone, or SHE product, developed by Duke Center for WashAid and their partners, including Sibuka. I think a lot of those team members are on the call with us today, so I appreciate that you took the time to join. But as we can all see here, just to walk you through, a user can insert a used sanitary pad. The waste material is then combusted. Ash is generated and stored for later collection and disposal, and a cleaner exhaust is emitted from the device. And so this is just one example, and product features can vary between products, but generally products like this, when inside the restroom facility, can enable a dignified, private, and safe option for the disposal of sanitary pads. The reason that we focused on decentralized incinerators is because the demand for these products in India has risen recently. So with examples across offices, schools, and airports, both the public and private schools and offices, I should say, that's what really drew our focus here. And so what we did was we set out to size and segment the market for these incinerator products in India, where we have seen the market demand so far, as well as in South Africa, where these products have not really meaningfully entered the market as far as we could tell, but where there might be opportunities still to improve disposal from these menstrual hygiene products. So as these products were relatively more common in India, we were able to do a bit more analysis there, talking to users and talking to existing technology providers. And we'll see some evidence of that later on, but we were able to use the same market sizing methodology in both India and South Africa. So what we see here is that in both countries, we defined market segments based on use case or where the product is used, as well as the owner of the bathroom, which could impact procurement. And then we estimated the total addressable market for the incinerator products in 2020, 2025, and 2030. And I want to call out here that we think that the market for community and public toilets is likely undersized. That's not a listed segment in our methodology. Public toilets span many of the segments we did include, but we're not able to include all locations, like some markets and recreational areas and other places where public toilet users might want access to an incinerator. So I just wanted to call that out as a likely limitation of our approach. But for each market segment, I want to call out that we use different and segment-specific assumptions. And we think segment-specific assumptions allow a more accurate market size estimation in each segment. So some of those include estimating the split between rural and urban populations in the segment. Like Laura mentioned, those populations have different typical approaches to managing their menstruation. So that drove our estimate of disposable sanitary napkin utilization in each segment. And also the average age of women and girls in the segment factored into our analysis. We can't really get into the methods too much on this webinar due to time, but if they are of interest to you, we could discuss it some in the Q&A period. And we could also, I could refer you to the full report online, and we're always happy to answer any questions that you might have as a follow-up after the webinar. So what we saw was that the total market opportunity after our analysis for these disposal incinerators is larger and growing faster in India compared to South Africa. So this is, remember, a total market estimate. So this isn't something that's accounting for the units that are already being sold and used in India. It's not a reflection of that trend. So I just want to call that out. And I'll say that in our full report, we also break down this total market opportunity by segment. When we did that, we saw that the offices were the largest segment inside of our analysis, at least in 2020, in both India and South Africa. So that was an interesting finding for us. We also saw schools were near the top of the market segments by size. That segment level analysis, and we'll kind of echo back to that with our interviews with manufacturers and users later, but the segment level analysis we think can help product developers as they think about where to focus their efforts, conducting stakeholder interviews and developing and eventually marketing products. I want to note here that besides the population size difference between India and South Africa, one of the big drivers is the utilization rate of sanitary pads in the two countries and in those two market segments that we define broadly. So I think that's a primary driver of the size of the market here. So any changes in those utilization rates over time and in the future, which we did not forecast out here, could be real drivers of how the market size changes. So like I mentioned, in India, where there is some familiarity with these products, we were able to qualitatively characterize product market fit through interviews that we conducted with end users and decision makers or purchasers in each market segment. So we only had a handful of interviews in each segment for this report at least, but we were able to get some early indicators from those. And one key takeaway for us from the qualitative analysis was that in the private sector offices, those ranked highly both in the quantitative market sizing analysis and the qualitative analysis once we evaluated these interviews. So a top in both categories, which was an interesting finding for us. This yellow box here just shows the kind of profile that we put together, combining the quantitative and the qualitative analysis in India. So if those types of profiles are of interest to you for other segments, I'd recommend exploring the full report where we have the rest of them. In South Africa, we did not yet conduct any end user interviews or identify, frankly, the adoption of the decentralized incinerators, which prevented us from getting those interviews. But we did note a few Indian incinerator manufacturers that marketed that they distribute units to South Africa. Unfortunately, we couldn't trace any of those leads down in the scope of this project. But we were able to talk to decision makers who might be in a position to evaluate incinerators in the future. And we understood that in the private office segment, that sometimes private waste management collection services might collect these menstrual hygiene products as well as other waste and perform other services in bathroom facilities, and that currently those separated waste streams may be autoclaved and shredded at more centralized locations. So think a much bigger heat treatment option happening off-site, so quite different than the decentralized incinerator approach. We also heard of some pilot collection programs in schools for another option for managing disposal of these menstrual hygiene products, but we didn't uncover a lot of detail about those programs. On our research, we did find some encouraging recent government actions on improving the accessibility of menstrual hygiene products. And these actions include a recent removal of the sanitary pad and tampon sales tax, as well as a program to provide free sanitary pads for poor schools. So I feel that these are really encouraging signs for equity improving in the management of menstruation, but I think that as these programs expand and sanitary pad use grows, there will be an opportunity and a need for sustainable disposal solutions for those products. So I see that as an opportunity, but I think for now, in terms of the incinerator, we see that there's probably clearly more work to be done in South Africa if you are a company looking to bring an incinerator to market compared to India, where the products are already being adopted. We were able to talk to 7 manufacturers that currently produce these types of incinerators in India. And so we were able to talk to them about their existing products, the features of those products, what they cost, and who they're sold to today. I'll say this is not an exhaustive analysis of all the different products on the market. It's not our attempt to rank the best products on the market or take any position to that end. But it did give us an initial indication of some key market factors. So across the products where we were able to conduct interviews, we saw that the average electrical incinerator costs about $265 US upfront. And we also saw a common theme in market segments of interest. We saw that higher education institutes were leading and then followed closely by offices across all of these providers. So interesting echoing of some of the findings from the quantitative and the qualitative market analysis that we had performed before these interviews. Finally here, and this is condensed from our full report, but we identified some similar themes across our interviews related to what we heard about buyers of these products, about what customers want. So one of the notes that we heard from the buyers was that this is the manufacturers speaking about their buyers' preferences, is that the buyers prefer incinerators that are smoke-free, that operate in a small footprint, and that are relatively low cost. We heard that today the incinerator products are sold through multiple channels, including online channels, and that they're not sold with financing options today. The manufacturers said that they didn't see financing as any real barrier for their customer base. And we heard that after-sales support is typically outsourced to local providers. We also heard that manufacturers were emphasizing a few different plans for future innovations to their product lines. One of those included improving their emission controls, another in enabling remote monitoring of their system, and one mentioned a desire to expand the number of feedstocks that might be applicable for their system. So that's all that I have to share now, but there is, of course, more information in our full report, same as Laura's, just a snapshot here. But with that, I think we can transition to the question and answer period. I haven't checked in on the questions that we might have received already, but if you haven't sent one in, I'd encourage you to send in a question related to my report, related to Laura's, related to this topic broadly, and we can try to field it. Andrea, do you have any insight into what we've gotten in the Q&A section yet?
Yes, absolutely. There's a question that came in for Laura from Calvin's asking, is there a significant difference in use between people living in urban areas and those in rural, and why is that?
Thanks, Andrea, and thanks, Calvin's, for your question. It's a good question. So there certainly is a significant gap in access between urban and rural areas. We see that in urban areas, there is more use of sort of quote unquote standardized products, in particular pads. And there was another question asking whether these were disposable or reusable pads. The data is actually only available just for disposable pads. And then in rural areas, we see that more women use informal or less standardized products like cloths, like cotton wool, like toilet paper, foam, natural materials. And what's very interesting is that these gaps tend to be for a number of reasons. So as I said earlier on in my presentation, there are a lot of intersections across different areas related to menstrual health and hygiene. So part of it is the cost-quality dilemma, especially in rural areas where distribution of products is difficult or is more difficult. Women can either find products that are affordable, but not the right kind of product that they want. They might not meet the quality standards, they may be difficult to dispose of, etc. Or they might find higher quality products that are expensive. Now, in this latter point, it's very important to highlight that in rural areas, it's the lack of well-supported distribution chains makes it even harder to find high quality products, even if they are more expensive. The other challenge really is related to the stigma and taboo related to menstruation, and that links back to the limited knowledge and awareness of menstruation and of the importance of improved MHH. A lot of households that have limited resources might find a lower willingness to spend those limited resources on more sort of quality standardized menstrual products, especially in areas where historically women have used less standardized products like cloths. So I'd say, you know, as with many of the challenges related to menstrual health and hygiene, it's not a single issue. It's probably a combination of factors that leads to the challenge.
Great. We have another question for you from Nenaju, who is planning to introduce disposable pads into their community. He would like to know a little bit more about the material that's used for reusable pads, along with disadvantages and costs.
That's a really good question. So the material used for reusable pads really depends on the manufacturer, and we see that they are larger scale enterprises, not yet multinational corporations, but larger scale social enterprises that have more standardized reusable pads. But we also see manufacturing of reusable pads at a very localized level. So the materials used really depend on the context and the type of manufacturer. This is linked to the cost. So the cost depends on the materials and depends on how easily available they are. And then I think in terms of advantages and disadvantages, there's certainly a clear advantage in terms of the environmental question. So there's less disposal. There's a clear advantage depending on the cost of the pad, but generally an advantage in terms of cost, because women tend to reuse pads for longer and therefore are able to offset the cost. I guess the trade-off in that is that the upfront investment is higher. So a lot of women or families may not have or may not be willing to invest those kinds of resources up front. I think the big disadvantage of reusable pads is the fact that because in many places there are no appropriate wash facilities, sanitation facilities, women find difficulty washing them appropriately, drying them appropriately, and this links back to the issue of taboo and shame. A lot of women are embarrassed of drying these pads in the open. They often need to be dried out in the sun to have the full sort of hygienic benefits. And so it may actually, in certain contexts, end up being a greater health and hygiene disadvantage for women. So I know it's a bit of a non-answer, but it's such a nascent field that it's really important to evaluate in the specific context.
Great. And one final request on this report from Avani, wondering whether you can share any of the primary research tools used to gather the data, such as the questionnaire or the interviews experience.
Oh, interesting. I actually thought that question was for the ITI report, but maybe it's for both. I can just share briefly on the data. So we didn't actually do primary interviews. We did do field interviews for our 2016 report, which you can find on our website as well. And they're actually specific reports that were published in partnership with PSI for, if I remember correctly, India, Kenya, and Ethiopia. So I invite you to look at those. For this report, we looked mostly at secondary source data. So interviews that had been conducted by others and published, and then large data sets. A couple of really useful ones are PMA 2020, which is where the data for product access and use comes from. And then there are other national level surveys, such as some of the large scale surveys conducted in India, for example, by the governments that have very recently begun to introduce questions related to menstruation, and that to its very limited questions. So I guess this highlights the opportunity around really building that data and evidence base.
Perhaps then, Tyler, I will have you answer the same question. Are there any research tools that we might be able to share?
Sure, and yeah, I had read it as for the prior presentation as well, but I'll say that the tools, the strategy that we used for the quantitative market sizing, which I think is not the question here, is detailed further in our full report on our website. I don't think that we have, but I'm not sure, the interviewer guide that we use when engaging with stakeholders on our report, on the full report on the website. But we do have a few different PDF tool guides for designing user-centered WASH approaches. And Andrea, that's not related to this report, but are you familiar if there are STEP resources related to conducting surveys related to WASH questions in the field?
I do believe that there is one resource on the website currently that speaks to user-centered design and survey guide creation on the website. But Avani, I would just encourage you to reach out to us, and if you have specific questions that we can help you with, we certainly will. Another question for Tyler from Marion. Are these incinerators found in Kenya as well, and how much do they cost?
Sure, thanks. So I'll say it's a good question, and I don't know the answer. That we looked primarily in India and South Africa for this report. Like I said, we didn't identify the costs in South Africa because we couldn't identify incinerators. But the average cost for the electrical incinerator in India was around $250. Unless another panelist or anyone else in the audience has a familiarity with whether or not these products exist in Kenya, and if so, what they're priced as, I think we'll have to let that go unanswered. But it's an interesting question, Marion, and I can look to follow up with you after the webinar if we do have an answer somewhere, but not in our heads right now.
Great. That is all the questions that we have in the Q&A pod at the moment. If anyone else has a last-minute question they would like to contribute, please feel free to jump in. Marion, with one other question here, are you able to partner with other organizations surrounding this topic? And I guess I will direct that at perhaps both of you. Maybe Laura first. How do you typically work with organizations in this space?
Thank you, Andrea. So partnership, I think, is at the center of making progress in improving menstrual health and hygiene for women and girls in different geographies. I think for far too long, organizations have worked in silos. So the sort of sexual reproductive health organizations and family planning focused organizations focus on one angle of menstruation. Social enterprises and multinational companies improving access to products focus on another angle of the challenge. WASH organizations focus on another angle of the challenge. And there's very little intersection. So from the perspective of the user, and as Tyler mentioned, really what's critical is to take the perspective of the user. For a woman or a girl, they're receiving different types of information from different sources related to this one experience that they have, which is menstruation. So I think partnering is essential. We ourselves at FSG, we are social impact consultants. So we partner with organizations to advise on their strategies to approach this work, on how they can think about market entry, particularly related to products, be they menstrual products, sanitation products, other kinds of products, how to build markets for these products. And then we also have a part of our work that is actual practice. And so we try to think about our current practices related to early access to early childhood education and then improved livelihoods and opportunities for women. And so in those, we try to think about very intentionally how we can take a more intentional lens or a more direct lens to improving menstrual health through our work.
Great. And I want to echo in response to Marion's question what you've just said, that we also feel that partnering is essential in this area. For our part at STEP or at RTI, we would be happy to connect with you after the call and over email and try to figure out if there are organizations or resources that we might help connect you to, depending on what you're trying to achieve in this area. We also work as consultants, so for a larger project like this, there could be an arrangement for us to provide support, but if there's anything we can do in terms of connecting you with other organizations and resources in the space that we know, we'll certainly do that. And we see partnership as critical to moving forward these equity challenges.
So we have one final question coming in from India related to incinerators and I believe behavior change for users of those incinerators. The student suggests that there are incinerators in his organization or her organization, but the burden of disposing pads still falls onto the sanitation workers instead of the user. And I think to me this suggests that there is a behavior change challenge getting users to actually place the products for disposal in the incinerator itself. Laura, Tyler, do you guys have any insights you can share around how to better implement behavior change strategies around the adoption of these new technologies?
Well, I don't have any great solution for that, but I think that it highlights the challenge that both Laura and I spoke about in our presentations, that the design of these products needs to be user-centered, and providing a great disposal product is not the full solution to these sanitation challenges. So I think that there is likely a behavior change component that could augment how these are used now and take that burden off of the sanitation workers. I don't know exactly what that change would need to be, but I do think it highlights for all of us that we need to ensure that we think of the whole sanitation system and not just the product when we look at implementing solutions. I know some of the product developers who we have spoken with and worked with have that need for a more of a systems level approach top of mind when they develop and look to launch their products. But in short, I'm not sure exactly how to drive that behavior change or make the process more accountable. I would be curious to hear from anyone else about ideas to that end.
Oh, maybe I'll jump in with one. I really liked what you said about the need to design not only like sort of point sanitation solutions, but actually think about the full sanitation system. And I think when we talk about the burden that is placed on sanitation workers, that needs to be taken into account as well. So how, from the perspective of the user, can we think about how they dispose that pad in a way that is safe and hygienic for sanitation workers? I think a big part of that is coming up with sort of the right kind of disposal scheme. And if I read correctly in your question, I gather that incinerators have been installed in your organization. And so I guess the question is how and when those are disposed of and in what way, and sort of the waste coming out of the incinerator. I'm thinking more about community level systems, where it's important to include the perspective of sanitation workers, because they will have a really critical role to play in continuing to dispose of waste. It can't really be done at an individual level. And so including their perspectives on what works, what doesn't, what is more or less hygienic from their own experience, I'd say is really important.
We're going to take one more question from Lillian. You guys are great. Thank you for sending all of these in. Lillian would like to know how households typically dispose of sanitary products, sort of working under the assumption that incinerators are more of an institutional solution.
Would you like to take that one? Sorry, Laura? I'll say for my part in our report that we don't have data on how households are disposing of these products, and that we did specifically look at incinerators in these public toilet or institutional contexts.
Thanks, Tyler. So at the household level, we see that when they're used, and it really depends on whether it's an urban area, a rural area. If it's an urban area, is it a community-based toilet, or is it a household, an individual household toilet? So it really, really depends on the context again. But we see that when there is disposal at a household level, specifically of sanitary pads, and it's different depending on the product, right? We see that there doesn't tend to be a focus on household-based incinerators, but rather on disposal with the broader waste of the household. The challenge here really brings us back to taboo social norms and stigma around menstruation, where a lot of women actually don't use disposable menstrual products. They tend to use reusable, but less standardized menstrual products like cloths or like other products, including cotton, sand, etc., because they are ashamed of including their menstrual waste in the household waste basket. So again, it depends by context, and all of these questions and challenges, I think the broader answer is it really varies depending on the context, even within an individual country, what kind of context you're looking at. But I'd say it's not just about how households dispose of menstruation or sanitary products, but if they do, and if they don't, why aren't they using them in the first place?
Great. And I want to just call out, in case whoever asked that question initially doesn't see Miles Elledge's answer, but thank you, Miles, for sharing that at the household level, there are some examples of menstrual hygiene pad segregation schemes that are going to centralized municipal incinerations, with 2 examples being in Bangalore and in Pune. So thanks, Miles, for sharing that.
Great. So with that, I'd like to thank our guests today and all of you for joining this webinar. If you want to know more from us at STEP, please do reach out. We've also included Laura's email address, so if you have questions on the FSG study or data, please reach out to her. The STEP website has more than 60 public market intelligence resources that provide a variety of different information, ranging from country-level market opportunity assessments to technology overviews. They are all available for you to download free of charge. Please take a look and explore that vast body of resource. It has largely been funded by the Bill and Melinda Gates Foundation in their efforts to reinvent the toilet and make a true impact in this space. Before signing off, we are going to post up a link to a 30-second survey that we would love for all of you to take. It really does help us ensure that the content and material that we're sharing is meaningful and responsive to your interests. So with that, I am going to conclude this webinar.